Welcome friends, colleagues, and my dear viewers. Welcome on MuniMeterHealth, your source of learning cardiology and human heart. Dr. Jaitly from New York. I'm your cardiologist. Thank you for watching MuniMeterHealth. In this short video, we're going to be talking about something very new that's happening now. Like we always give you some cutting edge and some exciting information on technology and science. So here's the subject we're going to talk about is what did AppleWatch atrial fibrillation study show? Now we know atrial fibrillation, just for the sake of the medical students, my dear students, the rhythm is very irregular. Here I'm drawing this, and the RR interval could be totally irregular here. So you could have very irregular ones, and then you have a pause, and then again. Now there are normally there are fibrillar waves here. So these are all fibrillar waves. We call them fibrillar waves. So atria are contracting roughly about 350 times a minute, whereas the ventricles normally is, again, in a controlled ventricular setting, it will be between 270 to 80, but a new onset atrial fibrillation could be very high. It could be 150, 160. Okay, so that's what atrial fibrillation is. Oops, I just tilted my screen a little bit, so let's position it back again. Okay, thank you. Now, the AppleWatch study was done in about 400,000 participants out of California, and again, the credits go to the Stanford Health Medicine and, of course, to the American College of Cardiology, which just recently published this data. It's a small study in a way, because there are only less than 500,000 people who were wearing the Apple Watch. Here I've drawn an Apple Watch, and they were carrying their Apple phone, if you will, and the phones had a downloaded app here, which was connected, which was obviously a Wi-Fi connected to your Apple watch wearer, and there was a program which was the heart program, which only checks the heart rhythm, if you will, and that heart rhythm was looked at here on the screen and was being tabulated on the app, and there will be a notification should the rhythm go erratic. So roughly, as I said, about 400,000 people, 400K people, they were the participants. Now, patients who already had atrial fibrillation, those patients who had atrial fibrillation, they were excluded. So these patients were excluded. Remember that. Okay, so patients who had atrial fibrillation, patients who were already on anticoagulation for whatever reasons, but most of these patients obviously require anticoagulation if they have atrial fibrillation. So these two groups were excluded. So, and then the participants were allowed to wear an Apple Watch and, of course, be connected via an app onto their iPhones. Now, it follows that as I suggested, that there would be a notification that will go to your to those individuals who had an erratic rhythm. So each time an erratic rhythm, like an atrial fibrillation, was detected, the tachogram, we call it the tachogram would send a notification on their iPhone, and the participants were required to report to their doctors. So they will call up their study doctor and say, look, I received a notification. Now, having said that, the doctors would then at that point order an EKG in a strip form and look up the strips in their offices, because there was a way to really look at in their offices, because these apps you could actually download and print them off and see them on their own computer screen if you have to. So the EKG strips were looked at, and what inferred was, by the way, only 0.5% of the patients out of this 400,000 pool reported the notifications that there was some degree of erratic arrhythmia, or an arrhythmia was detected by their apps. So arrhythmia was positive in about 0.5% of the patients only. Out of these 0.5% of the 400,000 patients, roughly, you could imagine that 34%, or nearly about, say, one-third of these patients actually who notified the doctors actually had AF, or atrial fibrillation. So what follows is when the doctors ordered the EKG strip, only a third of these patients demonstrated an atrial fibrillation, which was a remarkable finding. But it does not mean that the other 66% did not have AFib. It does not mean that they did not have AFib. it only means, remember, the rule in medicine is if you see something, you know exactly that is existing. But if it's not seen, it does not mean necessarily it's not existing. Okay, so following that rule, 66% or 2/3 of those patients roughly did not show atrial fibrillation on their EKG strips. As a result, it was inferred that necessarily they did not have AF, but it could not be proved beyond the doubt that atrial fibrillation could have existed earlier or a few seconds later during the time when the EKG strips were being recorded. So the point I'm making is, again, Apple Watch atrial fibrillation study here is really a state-of-the-art study which was just done. It didn't require literally any device to be bought additionally. Patients or participants, they were only required to have their iPhone and an Apple Watch on them. The app was free, which was downloaded on their iPhones as a result, and patients went about their own businesses and in their own day-to-day activities in their lives. That was the best part. So the clear advantages from this study, which again maybe the future trend would be, one, you will see that there will be increased participation because everybody loves technology now. So the technology savvy populations will definitely fall for such studies, and they would love to participate in that. One. Two, the future trends would suggest that patients do not have to come to the hospitals or to the clinics, so it can be done as an outpatient. So you could do all these studies in outpatient in the real life settings, and that's the best part. These patients could have their studies performed in their real lives. And the only limitation, of course, here is, and that's a caveat, you have to just remember, the only limitation here is the patients were required to report each notification that occurred. So if there was a notification that came on their app device, they were required to report and present. So we knew that 0.5% of these patients, these participants rather, they notified their MDs, but it could have been more. Many may have felt apprehensive. So look, I don't want to report my arrhythmia notification to anybody. I'm too scared to really know what's going on, even though I feel fine. Or it could have been under-detected if there was a noise. Now we know there is something called noise on the EKG where you could have artifacts. So noise is equal to artifacts, and these artifacts have to be, again, we don't want to make an over-interpretation of an arrhythmia when actually there is no arrhythmia existing. So sometimes you can have noise over. So these are some of the drawbacks of the study, but also clearly highlights that the tech-savvy people would love to participate in this study. And of course, patients don't have to come to the clinics and hospitals, go back and forth, and you don't need any personnel. All you need is a doctor, whoever the doctor who was participating in their study, to have that app notify to that physician, and the person notification could be done over the phone, and immediately an EKG strip could be looked at on the screen, and they can decipher whether or not the patient actually had an atrial fibrillation like the one that I've shown you. So it's a very interesting study, so stay tuned for more such cutting edge technology. Once again, these are only educational videos. So our goal is to really improve the medical education and of course the patient education together. We are not here to offer any advice, and we really hope that the clinical outcomes only get better by combining the two, the medical education and the patient education. Okay, so that's a nutshell on this short MMH video. The MuniMeterHealth, please continue to watch, because that's our library, which is now building by leaps and bounds across the world. We are now being viewed literally about several hours during the day, and people are learning, watching, and sharing amongst their friends. So again, colleagues, my friends, my students, and my dear interns and residents and fellows, stay tuned for more cardiology and knowledge about human heart. Thank you again for watching MuniMeterHealth. This is Dr. Jaitly. So long now. Bye.